Okay.
Good morning, everyone. I'm Sam Jejurikar, and I have the pleasure of being joined with Dr. Sam Rhee from Paramus, New Jersey, and Dr. Salvatore Pacella from La Jolla, California. And this is our fourth episode of 3 Plastic Surgeons and a Microphone. Before we get going, we have our standard disclaimer. This show is not a substitute for professional medical advice, diagnosis, or treatment. The show is only for informational purposes. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon and other qualified health providers with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show. And with that, I'll welcome my 2 co-hosts to the show. Gentlemen, how was your week? Anything exciting happened in your week that our viewers should know about?
For me, nothing. I think for us here in New Jersey, the COVID pandemic has sort of been the same. Everything has sort of not changed for us. I think we put on hold some of the things they were planning on doing, like indoor dining and bars and so forth, based on other states' experiences. And so it's a little frustrating from that regard, but I know a lot of people that went to the beach this weekend and are celebrating the 4th. So for us, it's sort of business as usual.
Yeah. So, California's experiencing an uptick in COVID-19, and, Los Angeles has closed some bars and restaurants and closed the beaches. So we had a massive influx of people coming down to San Diego. So we've just been laying low the last couple of days. I'm hoping they won't go ahead and close the beaches, but I think they're probably going to end up doing something this week. I imagine we're sort of heading backwards a little bit.
Are either of you guys noticing any impact in terms of number of patients you're seeing or your surgical practice at all?
For me, no. I'm still booked up. My surgical schedule is full. My office schedule is still full. I still can't see as many patients as I would like, because we are slower. We can only have 1 patient in the office at a time, that sort of thing. But I think people are still looking for treatment and care just like they were before.
Yeah, I mean, it's every week seems to be getting busier for me. So it's good to get back to work and just get back functioning here. So,
are there any things you guys won't do for patients, like any procedures you won't do, or any things you don't feel comfortable with that you take added precautions for because of the pandemic?
When I'm doing my filler treatments, obviously, a lot of stuff they can, I'm doing surgical procedures. They're still wearing their masks and so forth. Obviously lip fillers or chem peels and stuff, they have to take everything off. I'm definitely using an N95 almost all the time, as well as a face shield. So that's about the most precaution I take. There's really not anything that I have said I can't do yet. And we're testing everyone pretty rigorously for COVID. So I think that's the most we can do.
Yeah, same goes for us. So
yeah, well, we're one of the new epicenters here in Dallas with a huge uptake. We had 1,100 new cases in Dallas County just yesterday, and the biggest issue that we've come across in this past week is we still have a huge demand for cases, but because part of the protocol is to COVID test everybody before they have surgery, what I've really noticed this week is a delayed period of time to get results back for testing. So it's tough because you have to get testing within a certain window before surgery for the results to be accurate. But we're finding situations now where patients are trying to get within that window, but now they're not getting the results back in time. And so there's definitely been some issues that we've been encountering here, and I don't anticipate it's going to get a lot better this week.
What's the window that your hospital and facility are recommending? 48 hours, 72 hours?
I think practically speaking, most of them are accepting results that are done within a 3 to 4 business days of the procedure. But this past week, with testing done in Dallas County, it seems like it's taken 5 or 6 days to get results back. So we've had this catch-22 where if you test people too soon to get the result, well in advance to make sure you get the results back, it hasn't been a valid test. So it's been very frustrating from that regard. So now that we've had our weekly bleak reminder on the fact that there still is a pandemic, let's turn to something a little bit more uplifting today. Today, the focus of our show is going to be on breast cancer and breast cancer reconstruction, which is a really hopeful topic. Much in many ways with better outcomes what we're seeing for COVID-19. Dr. Pacella, who is an expert in breast cancer reconstruction, is going to lead this portion of the show. He has a presentation which he has put together for us to sort of talk about what's involved in reconstruction after breast cancer, so I'll turn the show over to him.
Great. Thank you, Texas Sam. Before we get into that, I just wanted to point out a little graphic for everybody here, actually on the right or left upper corner here. So we do have our Instagram handles on the screen here. You're welcome to follow us at Sam Jejurikar, at San Diego Plastic Surgeon, and at Bergen Cosmetic. We encourage you to come and take a look. We have some patient results, some information, and we welcome you to join. Well, thanks a lot. So we thank you for joining us for this very special presentation this Sunday morning. And we're going to talk about breast cancer today. So we have a very special guest to join us. But first, what I'd like to do is talk a little bit about breast cancer in general, and then sort of go into the treatment options. So if you could go ahead and share my screen here. There we go. Okay. All right, so we're talking about breast reconstruction after mastectomy. So in general, when we look at breast cancer, the common teaching is 1 in 8 women throughout their lifetime will suffer from breast cancer, and that it's technically not exactly correct. And when I mean exactly correct, I mean if we look at the lifetime expectancy of breast cancer, or the lifetime expectancy of patients throughout their lifetime, that's a 1 in 8 risk. And if you look at by age, it's actually quite rare for someone at a young age to get breast cancer. If you look at this graphic here, by age 25, 1 in about 20,000 women will suffer from breast cancer. But by age 85, 1 in 9 patients will suffer from breast cancer. So the important thing to understand here is the cumulative effect of the risk of breast cancer. And why is that important? Well, when you look at patients or women who have a family history of breast cancer, or who may have a genetic component to breast cancer, that risk becomes pretty extensive and high when women are younger. So patients who have a family history of breast cancer or have a genetic risk should really start the screening process quite early. We recommend they see a geneticist to discuss options and risks. When you're talking about breast cancer reconstruction here, it's not just one doctor that women will be dealing with or patients will be dealing with. It's really an entire team. I work out of Scripps Clinic. We're an affiliate with Scripps, or with MD Anderson, which is a satellite out of Houston, arguably one of the premier cancer centers in the country out of Houston. And we approach this through a multidisciplinary process. So we have a primary care doctor, obviously, that's going to be responsible for screening for patients. And once you're diagnosed, you really will meet with all different sorts of specialties, including a breast surgeon, a medical oncologist, if you would need chemotherapy, a radiation oncologist for other sorts of options for breast cancer, and then, of course, the plastic surgeon to talk about reconstruction. And our guests will sort of go into a little bit of this, but a coordinator is a very important person in the process. A breast cancer coordinator is really a pivot person or a quarterback that will coordinate all these appointments and make sure that all of the boxes are checked, so to speak, to see the right professionals. This can be an exceptionally overwhelming process for patients, and it's important to understand that, when you seek care for breast cancer, we want to do so in a way that's very comprehensive. Now, this is a very interesting paper which I came across in many, many years ago. And the title of the paper is Are Patients Making High Quality Decisions About Breast Cancer Reconstruction After Mastectomy? So obviously the breast surgeon will be responsible for removing or performing the mastectomy. And then of course we'll potentially be doing a reconstruction. So how do patients know about the options for reconstructions? And that's where plastic surgeons like us come in. So this paper was published in our major plastic surgery journal. So it looked at 84 patients across 4 major academic centers. Now, these weren't at community hospitals. These were at major academic centers. And what they found was that although all of the patients were given information or were potentially given information on breast cancer reconstruction, 26% of them did not recall any discussion with their provider at all mentioning reconstruction as an option. And that's really important because the process of learning about breast cancer when you're first diagnosed can be exceptionally overwhelming. And patients are not going to necessarily retain everything we talk to them about. So reconstruction may be the last thing on their mind. Now, of the ones that were given the reconstructive options here, only 37% answered correctly the types of knowledge. So although they were given information about breast cancer reconstruction, the retention of actually what the surgeon said was very poor. So what does that tell us? Well, it tells us a lot. As plastic surgeons and providers, we're actually doing a pretty poor job of providing information for patients on breast cancer reconstruction. So, and that's where we rely on a lot of accessory information on the media. We rely on the internet to help with answering some of these questions. So the lesson out here is if you're a patient and you were diagnosed with breast cancer, there are options for reconstruction. And if you feel like you didn't get that information, you need to ask about it. You need to talk to your coordinator, talk to your plastic surgeon about those different types of options. So what are the various types of options of breast reconstruction? Just very quickly here, we can use various things to rebuild the breast. So here's a graphic, an example. This particular patient here in this diagram had a left-sided mastectomy. And what we can use is the abdominal tissue. So this is a 100% organic reconstruction where we use the abdominal tissue to rebuild the breast. And it's called a transverse rectus abdominis muscle flap. There's a variant of this operation called a DEEP, where it's actually removed from the abdomen and plugged back into the breast utilizing little small blood vessels. So here's an example of one of my patients here. This is before her right-sided mastectomy here. And if you could see here, the right side was removed and this is her afterwards. Okay. So this right-sided breast was rebuilt completely from her abdomen, and the left side, a lift and a small implant was performed. So, we have some spare parts we can use on the abdomen, to rebuild the breast. So very good option. Another option, which is one of the most popular processes for breast reconstruction, is using a tissue expander or an implant. And what that is we're placing a deflated water balloon underneath the breast skin or the muscle of the breast and utilizing a little device, an internal bra, to help support the breast after surgery. And so you can see this graphic here, this tissue expander is placed underneath and then eventually changed out to a permanent implant. So here's an example. This is a patient before her double mastectomy, and this is her after, utilizing just simply implants to reconstruct her breast. So this is a very viable option that does not use your own tissue. And then, of course, we have combination procedures. So many times the skin may be way too thin to utilize just a simple expander or an implant after reconstruction. So what we can use is some of the muscles of the back. There's a muscle here called the latissimus flap, which is basically taken from the back and repositioned over to the front of the body. And an implant is utilized to create shape. The muscle is used to create coverage over the implant as essentially an internal bra or a sling. So this is also a very good, viable option for patients. So what I'd like to do here is I'm going to introduce our patient. Elaine is a patient who I've known for well over 10 years now. This is her Instagram handle at Sassy and Pink. She is a wonderful young woman who unfortunately suffered from breast cancer. And I thought it would be fantastic to bring her on the show because she's always so happy and has a wonderful smile on her face all the time, despite everything she's been through here. So without further ado, I'm going to hand it over back to Jersey Sam, and we'll get Elaine on here.
Welcome,
Hi.
Elaine. How are you?
Hi there.
I'm good. Thank you.
Hi, Elaine. Thank you so much for joining us today here. We're, as I mentioned, all three of us assist patients with breast cancer reconstruction, and it's just wonderful to have you on and share your story for everything you've been through here. So, how are you this morning?
I'm good. Thanks for inviting me. It's early for me, but
It's
we're
early,
fine.
early for me
We'll
too.
survive. We can survive breast cancer. We could survive early Sunday morning.
Sounds great. As long as we got coffee and donuts. I got the coffee, but not the donuts.
Exactly. Sidecar donuts.
Right.
All right. Well, so Elaine, tell us a little bit about yourself. How old you are, how old you were when you were first diagnosed, things like that.
Right. So I'm 46. I was 37 when I was diagnosed with an 8-year-old and a 12-year-old. So, it was a scary time. I'm 9 years out of treatment and very healthy and strong and just fully productive and just living life.
So when you were first diagnosed, it was 2010, I believe?
2011.
2011. Okay.
Yeah.
And so how did you first find out about this? Take us back to that time, that day. What was going on in your life? How did you find out about your diagnosis?
Right. Well, I was in Vegas on a Saturday. Obviously the week leading up to that was all the testing. So I was 37 years old. I wasn't eligible for a mammogram, but I was having some pain in my right breast for a couple months, actually. So every time I was in the shower, I would check to see if the pain was still there. There was a little soreness, but I never really thought anything of it. Me and my kids had just bought a Nintendo Wii, and we had been playing the Wii for a couple months, and so I thought it was just, it was my right arm, just, moving my arm, the paddle, everything. I just thought it was that. Went in and got it checked after a couple months, and to my OB/GYN, and she did a breast exam, and she felt a little muscle stiffness, which is what I felt, and she ordered a mammogram and an ultrasound, and I was going into the weekend and told her I had plans to go to Vegas. So she said, go ahead with your plans. We'll call you once we get the results. So I was actually, it was Saturday morning. I was in Vegas. She called me and told me the news that it was cancer. I had an idea going in that it was that. It was good or bad. My best friend had just gone through her breast cancer diagnosis a year and a half before I did. So she was fresh out of treatment when this happened to me. And so, she was preparing me for the worst news, and I was somewhat prepared. I think being in Vegas was good because I was able to distract myself a little bit until Monday, which was when they told me my coordinator would call to schedule and line up all my appointments.
Now, do you have a family history of breast cancer?
My maternal grandmother actually was diagnosed with breast cancer at 75. And she went through radiation. She's 89 today and still alive, but she did radiation, and so I did opt to take the BRCA test, but I don't have the gene mutation, which was good news for my daughters. That was something I was really interested in learning just for their sake.
I see. And so you said that you had a feeling that this was going to be breast cancer. Why did you have that feeling?
Well, a couple reasons. One, I had just seen my best friend go through it, and she was asking me what I was feeling, where the lump was. I shared that with her. I tried to feel the lump I actually didn't go in for 2 months, just because I originally didn't want to believe it could be that. But just checked for it for 2 months. After 2 months, it was still there, so I decided to go in. But actually, during my my mammogram and during my ultrasound, I could actually tell from the technicians' reactions that it was probably not good news. One of them, my ultrasound tech, actually, I don't know if they're allowed to say this, but my ultrasound tech basically said, this looks textbook, and so I think just to kind of prepare me. And so, going into my weekend and knowing I was going to get that call, I sort of knew already. It was still a shock, it was still, you get the call, you hear the news, you're sad for, a while. And then, you kind of just brush yourself off and get ready for the fight.
Right. So what happened? What happened from there? Tell us a little bit about what was going through your mind. What was happening in your life at the time? How were you preparing for this diagnosis?
Yeah. So I was very lucky because I did have my best friend who had just gone through this. So she was very well equipped to tell me what to expect. I also had through my medical group, the coordinator that you spoke about, who basically within the first week after diagnosis lined me up for 5 appointments. And I didn't even have to think about who to call or what doctors I should see. It was very well orchestrated and very well coordinated. I had one of my other best friends is an oncology nurse. So I just have a really great network of people in my life that just really pulled together and organized it all for me.
Yeah.
And so I guess I want to say my situation was probably a little easier than most who don't have that.
I see.
Yeah.
And I think that's a great, that's some great insight for our listeners and viewers, because, patients and women who are diagnosed with breast cancer, it's obviously a very overwhelming process. Am I going to die? What's going to happen? Am I ever going to look normal? And having that network of people around you, other patients, providers, people who have gone through the experience again, is so critical and exceptionally important that I see that. Many times, when I'm talking about reconstruction for a patient, I may put them in touch with other patients that have had similar experiences. And I know you've helped me out with that before. I've had that.
Yeah, and you did that for me too, Dr. Pacella. So you put me in touch with someone who had the exact same procedure that I had, and we're still connected. So we actually stayed connected. We made an effort to actually meet each other face to face a few years later, and still stay in touch. So that was actually very amazing to hear from her directly how the surgical experience was. And the fact that you brought up that article is really lines up with my experience, because someone very early in my right after I got my diagnosis, actually my best friend told me, always bring someone to your appointment that is going to take notes or record the session, because they do overwhelm you with so much information. You have to make decisions within a day or two, and you have to really look at all your options. And sitting in the doctor's office and getting all that information dumped on you, one appointment after the other, it was very helpful for me to go back to the notes that me and whoever I was with took, and just list out all the advantages. Okay, what did she say about this? What did he say about this one? Which one was the better option? What are the chances of survival if I choose this route? There was just so much to absorb, and you're just trying to grasp the fact that you have cancer, and then also having to make all these decisions really quickly. I was in surgery 3 weeks after my diagnosis. So it was, it was a week of gathering all the information, a week of, sorting through all of it, and then you're in surgery.
Right. It's a big process.
Yeah.
And so when you had obviously seen a medical oncologist, you saw a breast surgeon, and then of course you saw a plastic surgeon. Tell us your experience with the oncology side of things, the medical oncology side.
Mm-hmm. So that experience actually, again, was just a lot of options. Here's the type of cancer you have. You're, progesterone, estrogen positive, HER2 positive, whatever. It's like positive, negative, and that all dictates the options you have available to you. And there's hundreds of things to think about. Do you want to do radiation? Do you want to do surgery and radiation, or just surgery and chemo? Do you want to even do chemo? And then they throw at you all the survival rates for the different treatment options that you choose. So it was overwhelming. I went in to the process thinking I already knew I was going to take the most aggressive approach, because I didn't want to go through this again. And I felt I was young enough to handle anything that I could pile on to the options. So I opted for the most aggressive, which was the bilateral mastectomy. I did opt for chemo, even though my lymph nodes were not involved, but my tumor was a little larger than what you would expect from someone that is just discovering it. So it was overwhelming, but and then I had just seen my best friend go through chemo and survive it. So it's a lot. Again, it's a lot of information. Every appointment was a lot of information, and I do have a science background, so it was easier for me. And I did have friends taking notes. I did, record all the sessions so that I could go back to them and go back to all the information. But yeah, it's a decision you have to make that's personal, and you have to decide what's best for you, what you can handle, what you want the outcome to be. I think the hardest part for me was understanding that there wasn't a lot of data beyond 5 years for the treatment option I chose. So I'm like, okay, what happens after 5 years?
Right.
Can I only count on 5 years? There wasn't 10 years of data at the time.
Right.
So that's the scary part. I think the scary part about all of it is you just not knowing how long your treatment's gonna keep you alive.
Right. And, the interesting thing, Elaine, too, is, when we first met in 2011, things have changed dramatically in oncology and in plastic surgery in general. many at the time when you were diagnosed in 2011, it was actually fairly rare for us to recommend chemotherapy ahead of time unless it was a really massive aggressive cancer. And now probably a good half of patients are offered chemotherapy before surgery, because now the chemotherapy medications and drugs are much more targeted. If you have a 5-centimeter tumor and has a genetic component, some of the medication can really target and shrink that tumor basically down to nothing, which makes it a bit easier to go through a mastectomy. So your trepidation on the 5-year survival rate is dead on, because we don't have a lot of data beyond 5-10 years, and maybe that's a good thing, because we're retabulating all the data and retabulating our changes in breast cancer treatment. So now,
definitely.
When you were diagnosed before your surgery, did you have the opportunity? I know you mentioned you spoke to one of my other patients. Have you met with other breast cancer survivors or patients that have had that throughout your process?
Yeah, not the same procedure as mine. I think the patient that you put me in touch with was the only one that I know that has done the same procedure as me. But my best friend did, she just did the tissue expander and implant. So her surgery was a little bit different. And I've met a couple other patients who have had surgeries that were a little bit different. The interesting thing is I've met a ton of patients who are not happy with their reconstructive surgery, and have gone back multiple times to get it corrected and corrected and corrected. Thankfully, I mean, I'm just so happy with mine, but and the work that you did, Dr. Pacella. But I have seen and experienced through friends and family of friends, different situations where it wasn't as positive for them, and I just I reflect on my experience and do feel like I've been very lucky in that that I got it right the first time, and that and that I had such a great team working with me, and going into the reconstructive part, I had no clue what I wanted. I kind of just, make me look somewhat normal again. But, I mean, Dr. Pacella, you just did an amazing job at, making sure that I was going to be happy on the other side of this. And it was something I didn't really pay attention to, actually. It was something that I kind of just trusted that you would know what was best. And I'm really glad that I did, because I wouldn't have been able to make a decision, at least an educated one, or what would be best for me long term.
So let's back up a little bit. Let's talk about your first experience with my office and plastic surgery here. So tell us a little bit about the process, kind of how you were set up with an appointment, and kind of what your experience was coming in and chatting.
Right. Well, you were the last of all the doctors that I saw. So, they kind of went down the line: oncologist, medical oncologist, radiologist, and the surgeon, and then you, which was kind of the order of events. And you were assigned to me. I didn't pick you, but went into the office again, didn't know what to expect. I thought it was just going to be the exact same procedure as my best friend, because I didn't know, you just remove your breasts and you put implants in there, and you kind of just fill them back up. But yeah, going into your office, I mean, I could tell right away that, you were an expert at this, at the top of your game. You gave me all the options, the ones that you talked about earlier in your slideshow presentation. I mean, I was really hoping I'd be eligible for the tummy one because I've had kids, and then you looked at my belly and said, "There's not enough there." But yeah, I did opt for the latissimus dorsi option, but and I knew that was the hardest and longest recovery, but at the same time, you were very encouraging about it being the best option long term for me. And so with the mindset that I had, that I was going to take the most aggressive approach and do the most aggressive treatment options for the long term, I said okay. But I had it was interesting because your staff and the office and experience, the appointment experience, was so comforting for me, because it was part of the process that really set you up for living afterwards. It was one of those things that I did look forward to, and even my friends, my girlfriends especially, they were always interested in coming on those appointments with me and helping me choose, like, what size, what shape, it's just, you're customizing yourself. And you could almost see it as like an opportunity to have to come out of this with something for yourself.
Right.
And so the office experience was great. Like I said, it was kind of comforting, and was, if there is a lighter side of this, it was the lighter, more fun part of the process, because you did get to look forward. I mean, Dr. Pacella would, he'd mark my body up with lines and stuff, and he would, say, okay, well, make sure the scars are covered under your bra line, or so that when you're wearing a bathing suit, they won't show. And like, in my head, that was so awesome, because I was like, okay, someday I will be wearing a bathing suit again and out on the beach and on vacation, but I just have to do this right now. So so it was a very positive thing for me to have that as one of the things I had to look forward to.
That's great. Well, it's interesting when we your story is echoed by many of our patients, that we try to, if there's any part of the process of breast cancer diagnosis that is a less stressful part, is we try to make the plastic surgery experience less stressful, because we like to think that once you're with us, your cancer has been treated, and that's kind of the past for you, right? So of any of the providers that you meet that I listed on that slide, our office is really the office that you're going to be dealing with the most. You see us the most frequent. We have the most checkup appointments. We see you yearly almost after you've been through the process. So it's important for us to really establish a really good positive experience for you going forward, because quite honestly, if you have any issues down the road, we want you to come to us and chat with us about those. So I'm happy to hear that you've had that experience.
Yeah, and the procedure I chose was 3 surgeries. It
Right.
wasn't just the one, so it
Right.
was 3 separate surgeries, and that was almost the entire year.
Right. So let's kind of jump to the day of surgery. And so obviously we chose the bilateral latissimus flap. That's a large procedure. Tell us a little bit about your experience right immediately around the time of the surgery.
Immediately after?
Or like, so going
Or
into
going
in that
surgery.
day, and kind of the hospital
Oh my
experience.
gosh.
And
That was
toughest part,
okay.
right?
that was a long day, but I was asleep for all of it. So what I remember from that day is because we did the immediate reconstruction. So it was the mastectomy, and the reconstruction was 11 hours. And so I remember going in at 6:30. I had two friends and my mom with me, and went in to check in with you. You marked me all up, put the lines on, made sure my scars were going to be covered for those beach days. And then after that, I kind of just waited. My mom and my friends were troopers. They waited in the waiting room. But it was 6:30 a.m. I remember going in. I remember getting marked up, and then I just remember being on the operating table. And then someone counting down until I fell asleep. And I don't think I remember anything until after the next. I actually don't remember very much from the hospital. After that. I remember going home. I remember waking up and just feeling nauseous from the pain medication and the room spinning. But I don't remember much of the recovery part until I got home. So I was out of it.
Was it painful? Were you in a lot of pain?
Oh my gosh. So yeah, I mean, just to be honest about the whole situation, I felt like I got ran over by a 18-wheeler. Like because it was my front and my back and my underarms, and and thankfully, your patient had prepared me for that. She said, you're not going to be able to lift your arms. You're not going to be able to sleep on your back. And my friends who had heard all of that, they chipped in and rented a recliner, lazy boy recliner chair for me, and brought me a ton of pillows because they knew I wouldn't be able to sleep on the bed for a couple weeks. So it was painful. It was a long recovery. I mean, I think it probably I couldn't go to the bathroom by myself, just because I couldn't wipe myself. I couldn't give myself a bath or a shower because I couldn't raise my arms. So it was hard. I'm not going to lie about or hide that part. It was hard. But I was prepared for it because I did have that other patient tell me, okay, this is what you're going to go through. You have to prepare. You have to have. I'm very prideful. I was a single mom at the time, so I lived with just me and my two kids. And I'm not the type to ask for help. But your patient told me, you're going to have to ask for help, Elaine. You're not going to be able to do this on your own. And thankfully, she told me that because, my sister had lined up. I don't know if you there's this website where you do signups for helping people that are going through different challenges. And so my sister had set up this website with tasks, to cover being with me for certain hours of the day, picking up my kids from school, taking them home, bringing meals. There were like, when she set this up, there were like 200 plus activities to sign up for on a and for, a 4-week period. And within 10 minutes, all those activities had been accounted for and signed up for by people that wanted to help. But yeah, if I didn't have that, I would have been doing this alone at home, like having to stay on top. I had a notebook with all the meds I had to take because I was probably taking, I don't know, like, 10 pills of something a day at different times of the day. So, it was a tough recovery. It's probably 4 weeks before I felt like I could move and function on my own.
Do you remember the name of that website, Elaine?
Lots of Helping Hands.
Got it.
That's great, Elaine. Jersey Sam, could we go back to our presentation here? Let's share the screen one more time here. Okay, so I'm gonna just show a few things here. So Elaine, if you do recognize this person here, these were with this cute little bikini on here.
He's awesome.
So these are your pictures beforehand. So I'm just going to come back to these in just a second. So obviously we chose the latissimus flap, to me, early in my practice, this was a fantastic operation that I did quite frequently. Albeit I do it a bit less these days because some of the technology has changed dramatically in tissue expanders and fat transfer that the latissimus flap is not necessarily needed in a lot of opportunities. Now, I'm a firm believer in contributing back to the specialty and presenting and publishing. And we actually published our experience, 15-year experience with my mentor, Dr. Mark Codner. If you recall from our couple first episodes, Dr. Codner recently passed away. So, but he's definitely one of my mentors who inspired me with this operation as a fantastic operation for patients. So I just want to run through this little video here. So just a little bit of a disclaimer for our patients and those listening in. There are some graphic photos, some images here about the operation. So here is the latissimus flap. As Elaine mentioned, we mark her up, and the pink is what I would usually use as a guide for using a bra or a bikini afterwards. And this is the flap here on the back. This is after the mastectomy is performed. So after our general surgeon takes off the breast, it's really just an envelope of skin that's left behind. You can see the pec muscle underneath. Now we're going back to the back. We're cutting out a little paddle of skin here. And this skin paddle is going to be transferred with the muscle to the front of the body. So here we're dissecting out this paddle of skin. And now this is on the back. So we've opened up the muscle. We've left a little rim of fat on that muscle right here. And we have the skin paddle. So we're essentially going to use this to transfer to the front of the body. We make a little incision in the armpit to cut the insertion of the muscle so that it's almost completely removed from the body. Now we're leaving it just on its artery and vein here. And so we're transferring this muscle from the back to the front of the body right here through the armpit. So this is honestly the best part of the operation for me. This is the most exciting part, bringing it over to the front. And now it sits on the front of the body here. So now we have both muscles. This is done on both sides if we do a bilateral, and the muscle is redraped to the front of the body here. So this is outside of the skin. Now we use a tissue expander underneath. This is from a company called Mentor. This is called the Spectrum implant, which is a fantastic expander for this procedure. It's got a little remote port that we put underneath the skin. So here's the expander going in underneath the muscle within that skin envelope on the day of surgery. And that port is repositioned just under the fold of the breast here after everything is lined up. So you see that port sneaking in underneath here. And then we tighten up the skin around that skin paddle here, like that. And this is afterwards here. So so this is on the day of surgery, right afterwards. And we're able to lift or to put a little bit of fluid in the expander to create a little bit of shape and a little bit of volume. So Jersey Sam, we can go back to everything here. Actually, here. Go on. Okay.
Oh.
All right. Okay. Actually, so okay. So
no. Yes. No.
We'll leave this on. Okay. So
Okay.
So Elaine, if you recall here, so we did do 3 surgeries on you. The first was that big, large latissimus flap, and then you went through the chemotherapy process during expansion. And then we did another surgery, which was two other simple surgeries after that, relatively simple, I should say, where we remove the expander and put in a permanent implant. And then the final surgery is a nipple reconstruction. Due to our YouTube and Facebook regulations, we can't show any nipples here, so we'll just have to take our word for it. So this was,
I'm sure it was an awesome reconstruction. So.
this is so before the double mastectomy, and then this is afterwards. Now, Elaine, you just came to see me, I think, in March. Okay, so this is actually. I have pictures throughout your entire healing process, but these were actually pictures that were taken, I believe, right in March here. So this is a okay. 9 years down the track here. So now tell us, and you can see here the befores and afters, and maybe we can share Sam, if you want to maybe share the screen for all of us, and are you able to put this presentation with all of our 3 faces on there, or 4 faces?
All 4 faces are on here right now.
Yeah. Oh, okay.
Off the side.
Oh, no. Okay, gotcha. All right, never mind.
Yeah.
Okay. So Elaine, tell us a little bit about your thoughts on this. So what are your thoughts on the whole process of the subsequent expansion and the three layered process here?
Yeah, I would say the 3 surgeries. The first was the hardest to recover from. The second was okay, and then the third, surprisingly, was also a hard recovery, from the perspective that you did take some of my skin from underneath my belly to recreate my nipples, and the stomach part of it was painful, not being able to sneeze or stand or get up without any pain there. That was surprisingly harder than I thought it would be. But overall, again, I would do it all over again. Obviously, I'm 9 years out now. One thing I do have to say about reconstruction, again, when going into this, I underestimated the value of it. But coming out, I think the real takeaway that I've taken from all of this, from the reconstruction piece at least, is, living life after cancer. The hardest part is just. I think for some patients is cancer took a lot of things away from them. Like, for example, for chemo, if I had to go through chemo knowing I would never get my hair back, it would be hard to live each day, because you've got this constant reminder that chemo cancer took your hair away, and and you're living without hair, and that's how I feel about the breast reconstruction. Is if I didn't opt for the breast reconstruction immediately, and we're living every day, without breast, or, full of scars or whatever, then it would just be a constant reminder to me of what cancer took away. I don't have that, I have a constant reminder of what I gained. And there's a lot to be gained, not just physically. I mean, the reconstruction is a really awesome part of it. Like, I feel confident and good about, how I look, and that, I can look normal when I look in the mirror. And it's not something cancer took away, but there's also, a mindset that you develop. I definitely live a YOLO lifestyle. You only live once. There's Dr. Pacella, you talked about football earlier. I love football, and the way I equate my life now to football is I kind of feel like I'm I'm on a team playing in overtime, where there's always a sense of urgency. You're at the top of your game. You're doing everything you can to live this life well and in a meaningful way. Versus before cancer, it was like first, second, and third quarter of the game, and you're kind of just, there's still a lot of time. I could I could do that in the fourth quarter, or we'll catch up later, or whatever. There's the physical value of the reconstruction, where aesthetically I can look in the mirror and feel normal, and am not reminded about the cancer journey that I went through. And then there's a mental aspect of it too, an emotional aspect.
That's great.
That you're living your best life after all the treatment is done.
Right. And you've had a great cosmetic result, and I'm very happy with what we've achieved with you. But it doesn't come without some sort of price, emotionally, but also physically. For the benefit of having great scars on your breast, we've had to deal with some scars on your back, right? And the loss of those two muscles on your back. So tell us a little bit about that. I know you've had a little bit of a struggle with that.
Yeah. So actually, after I went through, before breast cancer, I never exercised a day in my life. Like, I'd never walked foot in a gym. But that's one of the things that I decided to take up after cancer is like, okay, I need to start working out. I need to start living a healthier lifestyle because, I didn't have the genetic predisposition to it, but, my oncologist is like, well, it's probably environmental, and so then I started paying attention to what I was eating and putting into my body and how I was taking care of my body. And so I started working out. I started lifting weights. I started training with a power lifter. And, this little frame, I'm 5'3" and 130 pounds. At one point I was lifting 200 pounds, over 200 pounds. But,
sort of like Dr. Sam Rhee. He's
Exactly.
That's more than me.
5'3" and never worked out a day.
I think Elaine's actually stronger than I am. That's good.
But I always told my trainer. So one thing, Dr. Pacella, I always told my trainer is, my surgeon told me that I would never do a pull-up and probably never ever be able to do a pull-up after this procedure. And so when I talked to my trainer about why I'm training, I told him, I want to prove to my doctor that I'm going to be able to do a pull-up one day.
That's great.
We talk about this in the gym that, my goal is to be one pull-up strong, just to kind of give myself a challenge. But it is, there's the back muscles involved. Exercising is a little bit difficult. Some exercise. The strange thing is, and this is just something my gym friends just are in awe over, is when I do back exercises that are supposed to target your lats, my chest is constricting and like flexing, and like I have like the best chest flexes because they're doing all the work, and it's just the strangest thing, but I've kind of embraced it as
it's a great party trick.
Yeah, exactly. An awesome like party trick. Superhuman bionic feature now.
That's great. Well, the good news is if that ever really becomes super troublesome for you, there is a fix for that. We can do that. So,
Okay.
Well, Elaine, that was just fantastic. We really appreciate you sharing with us, and I'd like to maybe invite the other two doctores to join. Did you catch that, Samir?
I did catch that, John. That made me very excited.
So we're gonna pay homage to one of our other professors at the University of Michigan, who shall remain unnamed, Doctore. So
He would say,
all right, go ahead.
He would say, I want it as dry as a popcorn fart, senor.
Senor, yeah.
Yes, he would. I want to thank Elaine so much for coming on. What I think the message that I've gotten out of what you've had to say today is just how much life you've had since your diagnosis with breast cancer. Not that you couldn't have done it without Dr. Pacella and breast reconstruction, but it clearly added a lot of quality. And The thing that I have walked away from, because I don't do nearly as much breast cancer or any breast cancer reconstruction at this point in my career, is just how great of a system you guys seem to have with the coordination. So if there was advice you were to give someone going through what you've gone through, and knowing now 9 years out, what were some of the good aspects of it? What would be the one or two big takeaways you would give to patients who are entering this process for the first time, specifically about breast cancer reconstruction and what it can bring to their lives?
Right. I would tell them, don't undervalue the process. If they really want to live for that life after cancer, it is something they need to consider. Two is educate yourself. Go into the appointment. Don't feel like you have to make a decision that same day. Again, I mentioned this earlier, take a friend with you or a family member to take notes and record the session or record the appointment so that you can go back to it and make a really informed decision. And then, the third thing is kind of just the decision is very personal. I'm sharing my experience. That doesn't necessarily mean it's going to work for someone else. And I definitely have met patients that have done different procedures or are still happy on the back end. So, do what feels right for you, because that's the only way you're going to be happy. But do make an informed decision, and then also don't underestimate the value of it. If your goal is to survive the treatment and live a long and healthy life. It does make you a little happier. It gives you a sense of normalcy, and it doesn't remind you. It helps to remind you that cancer didn't necessarily take anything away.
That's great.
Yeah,
absolutely. It's funny.
Thanks for wearing pink. I love
it. Oh, thanks.
Thank you for sharing your story, Elaine. I think of my patients, and I'm like Sam in the sense that I'm not doing as much breast reconstruction as I did in the past. I think Sal is being part of a major system is really what's key in terms of breast reconstruction. That's why I think it's Elaine's experience is great with the coordinator, with the teams, with having a lot of people together. I think the underlying message that Elaine has been talking about is support. Support when you have a lot of information that you have to deal with. Support when you have a lot of choices you have to deal with. Support when you have a limited amount of time. One of the things that struck me is that there is a lot of choice in breast reconstruction. And, Sal is one of those guys who does everything. But I do know that there's a lot of regional variation in terms of breast reconstruction. And I know some surgeons really push one method or another method or don't necessarily present all the options. And I think it is important to have someone who's pretty familiar with everything, interfaces well with the team, and is able to give a patient the choice that he or she needs to make the decision. And, obviously that is an amazing reconstruction that looks fantastic. I wanted to ask Sal, we can't see it because of censoring, but do you do the same nipple areola reconstruction as you learned in Michigan? Because I still do the same, and I think it's the best that I've ever learned, and I love that technique. And I remember making notes back in as a resident about how to do it, and I have not found a better way of making a nipple.
I agree. I still use the same method that the good Dr. A. Wilkins taught us, and I think it works phenomenal. Particularly the skin graft component, I think really helps with the texture. Many times, we add some additional tattooing based on the patient's desire to be a little darker or a little lighter, et cetera. So yeah. And the nice thing about the latissimus flap compared to, say, just a straightforward tissue expander is there's a tremendous amount of tissue bulk there. We can make the nipple very long and trim it down, and we can have a lot of projection with it. So I think it's a fantastic technique.
Right. Well, I think we're past the hour mark, gentlemen. So are we getting close to the end of this, or?
I believe so. Well,
Yeah.
Elaine, once again, I just want to thank you for joining here, and thank you so much for sharing your story. It's very inspiring, and keep smiling like I've always known you to. Okay.
Thank you. Thank you for inviting me and allowing me to share my story. And Dr. Pacella, I'm going to tell you, I am very happy with my results, but every time I go into a doctor's appointment where I have to, show them my chest, they tell me, the first thing they say is, "Who did your reconstruction? It looks really good."
Oh, thank you.
So just to allow you to go into Sunday feling really good if you didn't feel good already. But yeah, your work is admired by many, including your peers at the hospital.
Oh, I appreciate that. Thank you very much.
Yeah,
All
no
right,
problem.
well, you take care of yourself.
Thanks,
You
Elaine.
too.
Thank you so much
Happy
for your time.
Sunday.
Thank you.
No
All right.
problem. Thanks. Bye.
Okay. Bye.